Good afternoon, everybody. We're going to have a session of egg freezing today with Allison Campbell from Fertility. And she's going to be joining me online to take all of your questions. And I've got quite a few questions to answer, which is good. And then tomorrow, we are going to have Sophia Money Coots, yes, that is her real name, coming on, talking about her experience of egg freezing and her journey. So Alison is just trying to join me now. And if you're listening to this, Alison, can you send the request through again for me, please? Or I'll just have to press this button here. Sorry about this, folks. Let me just see. Great, she should be joining me any minute. So please keep your questions coming through. And as I say, we're going to sort of be covering egg freezing. Hi, Alison, how are you?
I'm fine, thank you. You?
Hang on, I must turn the sound up. I can't hear. Can you hear me?
Yeah, it's clear.
It's funny, I can't hear you very well.
Oh, shall I come a bit closer?
I'm hearing you from a microphone somewhere. It's really weird.
Oh, have you got your earphones plugged in, maybe?
Oh, yes, hang on. That's probably absolutely right. I'm just going to turn the Bluetooth off. Will I lose you? Hopefully not. I'm going to get my earphones.
I was having a panic then when she said send another request, because I'm not so sophisticated. I didn't really know how to send a second request, but anyway, we're good.
Oh, yeah. Turn my earphones off. I wonder why you were coming from the table. I couldn't work it out. Anyway, thank you so much for coming on this afternoon. It's brilliant. And you're now a doctor, aren't you? Dr. Allison Campbell.
Yes, I had the PhD viva in August. So yes, that's under the belt now. Pleased.
Is it a relief?
Yes, it was a lot of work. I've got my next viva coming up. I'm going to be applying to become a consultant embryologist. So I've got another viva at the end of October, and then I think I'm done.
Right, brilliant. So today I've got lots and lots of questions, and there's a lot of interest at the moment around egg freezing. I don't know why the interest is growing. Maybe it's because of COVID and it's getting people, women to start thinking about it. And I'm a huge believer in egg freezing because I feel that it gives women more choice. And certainly for me, my daughter's in her 30s now, she's happily married, but if anything were to go awry, I would certainly suggest it rather than have to wait and panic about meeting somebody and that awful tick-tock of the biological clock that women worry about. So can you sort of just tell us a little bit about it, the process and the freezing, etc., that would help people that are listening, and then we can go on to answer some questions.
Yes, well, it's a phenomenal process, and over my career I've seen the technology develop, and now the last few years we're seeing exceptional results with egg freezing. So basically what happens is the patient would have a consultation, and then there are really three steps. There's the stimulation of the ovaries, because we need to collect a good number of eggs to freeze. Like with anything, if you're banking anything, you want to bank a good number. So the stimulation of the ovaries, then there's the surgical procedure to remove the eggs, and then there's the lab work, the cryopreservation, the freezing of the eggs, and the storage. So they're the steps, really. But as I say, it's very successful. Around 85% of eggs go on to survive the freeze-thaw process, so they are quite resilient. And pregnancy rates, depending on the female age, can be around 50%.
Okay, so it's interesting, isn't it? Because I know it doesn't guarantee a baby, but it does really increase your chances. But on average, how many eggs do you need to make a baby, so to speak?
Well, with egg freezing, we've looked at all the literature, we've looked at our own data at Fertility, and we believe the magic number, the average magic number to give a realistic chance of a baby in the future is 20 mature eggs. So you need to, we've extrapolated all the data, the birth rates, and I think that's a good benchmark, which is what we're aiming for when we freeze eggs. So that might mean that the woman has to go through more than one stimulation. Not always, but sometimes it takes more than one round to get that 20.
Yeah, and that's quite hard as well, isn't it? Because there's a financial cost, an emotional cost, a lot that goes with it. I'm often interested when women come along and they think it's something they can do at lunchtime. I just pop in and get they don't realize there's quite a process that is involved. But anyway, I've got lots of questions to go through, so we can start going through them if you're happy with that. Anything else that you want to sort of say on that?
Well, I think we should say, we're talking about cost, because it's very important.
Yeah.
It depends. So at Care Fertility, we've thought about this long and hard, and we've done some modelling and we've calculated, and we want to offer this. We feel very strongly that it's important that women have these choices, as you said earlier. So we've put together a package which it's up to 3 rounds, 3 egg collections, in order to get the 20 eggs. So we don't need to charge for consecutive treatment. So if you do need to have more than one, then we can go up to 3, which we think is reasonable, to get those 20 eggs. And the cost of that is around £5,500. So I know it's a lot of money, but many people say we didn't expect it to be that. They thought it would be much, much more than that.
No, well, it is. It can be. It can be up to 15,000 if you go and you do it 3 times. So I think it's good. But we'll give the number out at the end. So if people are interested, there's someone they can phone and they can ask about it. Yeah,
great.
Yeah. So anyway, some of the questions here, and it's all, a lot of the questions are repeating, so we'll cover it. A lot of it is about fertility assessments and egg reserves and my AMH is low, etc. So the first question is, I'm 35. Is it too late to freeze my eggs? And does a fresh or frozen embryo have a better chance of implantation?
Right. Well, 35 is not too late. Every woman will need to have the consultation to understand their own predicament. So it's not as simple as age, although that is a very big factor in this. So we look at not only the age, but also the body mass index, the antral follicle count. So there are other variables that we can look at to try and tailor the advice that we give to each woman. So no, 35 would be, a good age. I think ideally,
because a lot of women get really wound up that at 35 their eggs are going to fall off a cliff, and very often some women are more fortunate than others when it comes to their egg reserves, but you've still got a lot of chromosomally normal eggs at this age.
Yes, and we do know that fertility in women does decline quite rapidly after 35. So ideally we need to get the eggs banked before the age of 35. And
that's hard because a lot of women come along at 38 and 40 and still go ahead with the procedure, but it depends on their egg reserves. Some of the women here are asking, Alison, where can they get this done? And this is at Care Fertility, and the cost is £5,000 for 3 rounds.
Yeah, well, I need to just clarify this. So so
is it on the website?
It's on the website. It's the product I'm talking about is not for everybody, unfortunately. It's not. It wouldn't work for everybody, but it's called Egg Safe. So this is up to 3 rounds of egg collections to get 20 mature eggs. So if we get 20 in the first round, brilliant. That's it. We don't need to carry on. But if we don't, we can keep going for 3 rounds. They need to pay for drugs on top of that. So that's variable cost depending on how much stimulation drugs each woman would need. It includes a year's storage, but after that, then there's a annual storage fee of £285. And that's the same with frozen sperm, frozen embryos. But the most important point here with EggSafe is that they need to meet criteria so that we're confident that we can treat them and get this good number of eggs for them. So the women need to be under 36, body mass index under 36, and the antral follicle count over 14. So we know they've got their eggs are potentially there to collect.
Great. They can read about this anyway.
Yeah, all that it's very clear on the website. But if you're over 36 and 35 and that you don't meet those criteria, we can still freeze eggs just on a case-by-case basis. So there is also a different fee for that, which I think is around £3,000.
Okay, that's fantastic. Okay, just the final part of her question. Does a fresh or frozen embryo have a better chance of implantation?
Well,
so she's asked about freezing eggs, then it's about embryos.
Yeah. Well, we find we get similar results whether they're fresh or frozen eggs or whether they're fresh or frozen embryos. Not all clinics will have the results the same as we do. So it depends on which clinic the patient's at. But
Yeah.
in general, we do expect frozen eggs and frozen embryos to perform similarly to frozen to fresh. So it's like for like. We've mastered it now.
Okay, fantastic. I think you've answered this. How long can eggs be kept frozen, and what is the yearly fee with care? What's involved in the process of using the eggs, and is that included in the cost or extra?
Right. So the storage consent, the limit is 10 years, unless there are special circumstances which may be surrounding cancer treatment or something that's going to cause permanent infertility. So 10 years is the statutory storage period. The annual fee is $285. So let's use an example. So if a woman came to have her eggs stored aged 30, and when she was 38, she'd found a partner, or she decided she wanted to use donor sperm, she wants to start a family, then we would thaw out some of the eggs, inseminate them, and then transfer the embryo at that time. So there are two separate procedures. So the egg freezing is separate, but when the time comes for treatment, it's the insemination where we mix the eggs and sperm to create the embryos, and then we transfer.
Yeah. I think what's hard as well, because a lot of women that have their eggs frozen, they haven't been back to put them back, have they? So, you know, again, it's sort of choosing the time, etc.
Yeah, well, it is. It's an insurance, really, isn't it? Because nobody knows
Yeah.
what's coming in the future. So I would say most women who freeze their eggs at the moment are thinking, well, I'm not ready to have a family now for whatever reason, whether it's partner, it's I want to travel the world, whatever it is, it's their choice. It's not the right time, but they feel reassured if they've got eggs stored, so that in the future, if they want to start a family and they're having difficulties because their age is increasing, then the eggs are there if they need them.
Yeah, and if this is available, somebody's just asked, throughout care, not just in London, it's at every clinic. Yeah,
yeah, we have 11 clinics across the country, so we're well spread.
Okay. Okay, how to improve frozen embryo transfer chances with adenomyosis? What are the odds of being successful? It's a difficult one, isn't it?
Yeah, that's quite a clinical question, isn't it, really? It's probably better to have a medical consultation if you've got a particular condition. It's not really my area of expertise.
No, I agree. Can embryos be frozen, thawed, biopsied, then refrozen and later thawed without damage? That's a good question. That's come up a few times.
Yeah, that's a great question. And yeah, it's absolutely possible. So many patients have their embryos frozen or had them frozen 5+ years ago, and now they're hearing all about PGTA and screening of embryos. And it's absolutely possible for us to thaw them out, to take a biopsy, take a few cells from the embryo, to refreeze the embryo while we send the biopsy off to the genetics lab to count the chromosomes, and then to have the embryo rethawed for transfer. They are unbelievably resilient, more resilient than eggs. So with eggs, we see around 85% survival. With blastocysts, so with the embryos, we see around 99% survival rate. So they're really, really easy to freeze and thaw.
Yeah, fantastic. Okay. I'm high ovarian reserve, but I'm 40 years old. Is it good to freeze or better have another round of IVF?
40 years old, I would try fresh. Yeah, I don't think
her ovarian reserve is good, so she should try, and there's always the option for that in the future, isn't there?
Yeah, see how many eggs, and then take the decision at the time. But probably if she has a partner or she's already using a donor sperm, then create the embryos, freeze in any excess embryos, and have the transfer now.
Yeah, no, I agree. I think that's a good answer. I'm 33 with a very low AMH. Any top tips for egg freezing aside from supplements? And this has come up a few times in some of the questions. There's another lady that I've got further down on my list, and you know, for her, she was saying, what is the lowest AMH you can have to freeze eggs? And it's a difficult one, isn't it? Because it's managing expectations, it's going through this whole process, and sometimes not even getting to the point where you can collect any eggs. So it's difficult, isn't it?
It is. I would think probably the best thing would be to have a round of stimulation to see how you respond,
Yeah.
and
Yeah.
hopefully we collect some eggs. And whilst we talk about magic numbers, you know, quality is the most important thing. We may find we get 2 or 3 spectacular eggs, and that's all that's needed. So it really is just have a try and see what happens. But
yeah, you're absolutely right, because again, at 33 she's young, and how often do we see women that come in with low egg reserves and they produce far better than we're expecting?
Yes.
You know, so you know, hope is really, really important here, but not false hope. Okay, any advice for obese people struggling to lose weight, to do egg freezing? And this is always hard, isn't it, when women are overweight, because what is the BMI for somebody that wants to freeze their eggs?
Well,
What does it have to be?
it has to be under 36
35. Oh, it's under 36. Yeah.
for the egg safe program. So yeah, I mean, you're probably a better expert on weight loss with your expertise than me, but it is important, and there is a strong relationship between obesity and fertility. So we know that we need to give all the support we can. But
Yeah, and it's hard. It's never that easy about just go away and lose weight. You know, very often there's underlying hormonal issues, there's emotional issues, and it's desperate for some of these women because they're doing everything. It's not like they're sitting there just eating all the time. They're exercising, they're doing everything they can. But also there's the risk factors when you have any anesthesia, isn't it, or any sedation when you're overweight. Yes. So there's a risk as well. So it's a difficult one. Okay, next one. What are the real chances of success if freezing eggs at the age of 40? Just had to do a freeze-all. How can I best prepare for a successful FET? Only 1 blastocyst after 20 collected. PCOS was a factor. Will FET decrease the chances for that one?
So it sounds like it's frozen embryo rather than eggs in this case.
It says, what are the real chances of success in freezing eggs at 40? She's just had a freeze-all, but it must be embryos, I would think.
I think so, yeah, by the sound of it, but we can try and answer both anyway, just in case.
Yeah.
Well, no, I don't think a frozen embryo transfer would compromise anything, and in some ways it could be beneficial compared to a fresh transfer. So with a frozen transfer, we make sure we optimize the time of the transfer. Make sure the endometrium's perfect, the timing's perfect, and of course all those stimulation drugs that were there when the eggs were developing will have gone because that was in the fresh cycle. So there is a strong argument in favour of frozen over fresh. So it's certainly, we wouldn't think there would be a compromise from that, providing the embryo survives the freeze thaw, which they do almost all of the time. With egg freezing for someone aged 40, it's we have some amazing success stories, but we also have a lot of disappointment. So it's one of those, again, to try a stimulation regime if the consultant thinks that's sensible based on your medical history and your fertility MOT tests. It could be worth a try, and we have seen successes in age 40 and above.
Yeah, we see a lot of women at 40 that go on to get pregnant, which is brilliant. Okay, another sad one here. I'm 42, recently separated from my partner. I had an early miscarriage earlier this year. I don't know my egg reserves, if they are at good level, but could I freeze my eggs? And also, would I be able possibly to be able to screen them as well?
Whilst I'm sure the miscarriage was very difficult, in some ways it is a positive sign. There was a natural conception, and it's not that long ago, so fertility is demonstrated to a degree there. So I think it would be worth a try to freeze the eggs. We don't generally screen eggs for aneuploidy, which I think is what the question's related to. but we could, in the future, when the eggs are used and develop into embryos, then we would suggest biopsying then and do the aneuploidy screening at that time.
And, you know, so what is the success rate of that? You know, if somebody has got some embryos, they have to have a certain amount, don't they, to be able to screen?
Well, we can screen a single embryo.
Okay.
Yeah. As the female age increases, the proportion of abnormal embryos increases. So the chance probably with no screening would be around 10% in a woman aged at 40 or early 40s. If we detect there is a euploid embryo, which is what we're looking for, the normal copy number of chromosomes, then the chance of that implanting is just as high as if the woman was 30. So
yeah,
that's what we're looking for. But it's a brilliant technique, really, because we can screen the embryos. If we haven't got any euploid embryos, then we've avoided all of those futile embryo transfers. If we have, then we've got a great chance of success. So it's good for setting expectations and maximising outcome.
But also it's a relief for a lot of women that are at this age, because that's one of their biggest fears is, you know, is it normal to go back? I know it's not 100%, but it gives you a good grounding, doesn't it?
It's good.
Yeah. I think you've answered this, Alison. What is the lowest AMH you would freeze eggs at? Well, we talked about the managing expectations, and if it's really low, it's sometimes even hard to get to egg collection, isn't it?
It is.
Yeah, I think we've answered that. There's another question here. What is the conversion success for frozen eggs to pregnancy in over 40s?
Frozen eggs to pregnancy. Well, so it very much depends on what age the woman was when the eggs were frozen.
Frozen, yeah.
So
yeah.
If they were frozen at age 30, then we would be expecting around a 50% chance of success with each embryo transfer. So really successful. If they were frozen at 40, then we'd be looking much, much lower, probably around 10 to 15%.
Yeah, okay. I had ovarian cancer and my eggs were frozen 6 years ago. This lady doesn't say how old she is. Will they still be okay?
They should be fine. They should be. Technology has improved in recent years, so it depends a little bit on the procedures that were used to freeze them. At 6 years ago, they could have been slow frozen, or they could have been rapid freezing, the vitrification that I was talking to that we use today. Either way, the storage itself doesn't cause any issues. So they can sit in the liquid nitrogen, which is minus 196 degrees, where we hold them for a very long time. And we don't have decades of data, but we know certainly that they can stay safely for 10 years plus and still give success.
Can you just explain a little bit about the vitrification for some of these ladies listening?
Yeah, so we used to use techniques with slow freezing and computer controlled freezers that really took 2 hours to take the embryos down very slowly to low temperatures, and the removal of water and cryoprotectants across the cells. But the issue with that old technique, and it was the same for embryos, that water remained inside the cells, a little bit of water, and when water freezes solid, we know that it goes spiky. You know, you see it on the car window in the winter, sort of ferning, and it's spiky. And so those sharp edges could damage the cell membranes. So we didn't see very high success rates with that technique, although there were successes, but it wasn't as efficient as vitrification. So with vitrification, it's a much faster process using different cryoprotectants. And all of the water is removed, and we use, well, you might have heard of a water bear. It's a tardigrade, a little creature. You should look them up. They're the cutest thing. They're microscopic little living creatures. And there's
I've never heard of that.
Oh, they're so cute. The little creature inside, the little solutions inside, it's like a sugary solution. And it's the same solution that we use in the vitrification medium, because when it goes down to very low temperatures, it doesn't make these sharp spikes and the water's gone. So it turns into a glass-like state, which is where the word vitrification comes from. So it's...
Oh, right, okay. So that's improved over the years.
Yeah, I'm going to show you, if I can do it, a little picture.
Oh yeah, do. Oh, you're getting very technical, Alison. Oh, we're seeing your whole house now. That's interesting.
Can you see? That's them.
Oh,
Aren't they cute?
yes. They are cute. I've never heard of that before.
Yeah, no, they can survive anything. They send them to space. They can dehydrate. They can go to low temperatures. I think they've been around for millions of years, but they're quite phenomenal. But I love it when biology in a different field of biology can influence another field of biology with great success.
Yeah, no, absolutely. Okay, there's another one here now. Are there better months than others in terms of egg supply? Can your egg reserves go up and be better some months than others? That's an interesting one.
I imagine that could be the case.
I really believe it's the case.
Yeah.
I really think that some months are better than others, but it's difficult to know when, isn't it?
Yeah, and it's hard to prove because no one's going to be monitored month after month after month. But it does feel that, yeah, that could be the case.
Yeah, but again, with egg reserves, they might go up a few marks, but they're not going to go up from 5 to 25. You know, it's generally along the same level. Question here, I've got a healthy AMH level. How can you find out your level of ovarian reserve? Well, you can find that out by going to a clinic and having a blood test and an antral follicle count scan, and that will come back with a level for your age against a reference range. So the doctors are able to advise you then what your likelihood is of IVF being successful, how many embryos you'll get, or how many eggs you get when it comes to freezing. So that is like an initial consultation that you would have at any clinic to assess that. Final question here. Can I move my eggs from another clinic? I don't feel where I've been supported at all.
Oh, yes, it's possible to move your eggs between clinics and your frozen embryos. Yeah, the embryo.
I don't think a lot of women realise that. I think when they've been unhappy, they think they've got to stick it out, and very often you can safely transfer, can't you?
Yeah, we do it all the time. It's it's very common to do that. The only thing I would say is just make sure that where you want to take them to is familiar with the method of freezing that took place when they were frozen. Most of the protocols that we use are quite common across the clinics in the UK, but it's just worth checking.
And what would they need to ask if they want to check that?
Well, you could ask the embryology teams would generally liaise to say, well, what protocol do you use, what reagents, and that's, yeah.
Yeah, and they can safely travel across London, up and down the country.
Yeah,
everywhere.
We have transport shippers, so a courier takes them in at very low temperatures straight into storage at the other end. So it's very, very safe and effective.
Oh, fantastic. Well, I've got to the end of our questions here, Alison. So if anybody wants to find out about the EggSafe scheme, who do they phone, or where do they go?
I think the best place is to look on the Care Fertility website. Just search EggSafe, or just ring the inquiry number, and anybody would be able to advise. Okay,
so you can phone Care Fertility, or you can phone Zita West Clinic on 0808 196 4060. But we don't do the same EggSafe as you do, so it sounds like it's really, really good. How long is it advisable to rest after a frozen transfer?
Well, we don't recommend any great length of rest, really. We just ask people just to be a little bit careful. You know, don't go digging in the garden. But after the transfer, most of the time, patients will just get up off the bed, go and have a cup of tea and leave. It's not, so there's no need to lie for 2 hours.
Yeah, see, I believe that you should sort of rest, but that's sort of like a different opinion. I think you've gone through so much and it's all so stressful.
Yes, yeah.
That you just need to lie on the sofa, turn the telly on, have a cup of tea and a cake or something, you know, just to bring it all down. Because it is interesting around transfer, isn't it? You know, when you see couples that come to the clinic, there's so much stress, there's so much landing on this, that the amount of arguments some couple have, you know, like the partner will lose his car keys or get stuck in traffic. So there's a lot that goes on around it. So once you've got them in, just putting your feet up is really good. This is the final question here. Is using unfreezing the egg in the future included in the initial 5K cost? So I presumably, yeah, the thawing she probably means.
No, that's the cost. That 5,500 cost is for the egg collections, up to 3, the freezing, the first year's storage. But then if you come for treatment in the future, then there would be different cost for the thawing and the insemination and the transfer.
Yeah, because presumably when you come in the future, you put the sperm together, you make the embryo, and that's like a separate IVF cycle, isn't it, so to speak? Do you feel that an embryoscope helps, and why? That's a good question.
It's a good question. Absolutely, I think it helps. My quickest answer would say it gives uninterrupted culture of the embryos, so we don't need to take them out of the incubator to look at them because the camera's taking photographs. It's giving us dramatically more information on the developing embryos. It's taking a photo every 10 minutes through multiple focal planes. So you compare all that information. We can watch a video from fertilization to the point of transfer. So 5 days of development compared to standard methods where we've got a few days snapshot observations. And we've developed algorithms which help us know what patterns of development are associated with viability. So we know which embryos have the best chance of implanting. So we can pick that one first, whereas standard methods are much more simplistic and subjective. And each embryologist might choose a different embryo, whereas with the Embryoscope, with our time-lapse care maps, we would choose the same one because it's evidence-based.
Well, maybe you can come back on now that I know you can use your computer and you can show us. Maybe you can have a look at it all. That would be quite good, wouldn't it?
That would be fun.
Yeah. So the final question now, this is the final question. Is only 1 blastocyst from 20 eggs an indication of poor quality? I don't know if this is the same lady that has emailed in with a PCOS. I'm not sure. But I think that sometimes what happens here, that every single part of the procedure, from the way you prepare, I believe, the way you prepare, the protocol you put on, the collection, the lab work, everything's all important, isn't it? So how would you answer that question?
Exactly.
20 eggs is good, yeah, but it depends on whether they're mature eggs or not.
Yeah, and it depends on the sperm. It depends on so many factors. So, yeah, it's not a great outcome, but there was a blastocyst, so there's potential to make blastocysts because some embryos don't get beyond 8 cells. They arrest or they degenerate.
Yeah.
So we'd need to look at the details a bit more closely, but fertilization was achieved, so that's a tick, and there was a blastocyst, so that's a tick. Next time, hopefully, whoever did the treatment can try and improve upon that and learn from what's gone before and try and modify the treatment to end up with more blastocysts to give a better chance.
Brilliant. Alison, thank you so much for coming on, and we'll see you in a few weeks' time, I hope. And we can sort of do more on embryology and everything like that.
Thank you.
Great. Okay, thanks so much. And thank you all for listening today. This will be available on the IGTV channel at Zita West Clinic. And I look forward tomorrow to having Sophia Money-Coots and talking about her journey. But thank you very much, everybody that's listened. Bye-bye, everybody.